guys, welcome back to the channel. Today we are finally addressing that question you've been asking us in probably every single video about our healthcare situation. We get that question a lot, don't we, about what about health insurance?
We do. We get that comment on almost every video, depending on if it's on healthcare or not. So we're going to talk about it here because it's probably been a little while since we've done one. So we have a few things to discuss. First is what we've done in the past, what we're doing now, what some options are you, and some overall thoughts on healthcare while you are traveling. So there's several options you can have. The first is the ACA, and the bad thing about the ACA is it doesn't really cover you when you travel overseas. So that was pretty immediately something that is just thrown out the window for most people. Another option that does work fairly well is a medical share program. And there's a lot of these that you can get into that will work for you overseas. And we have been in one of those, and it was pretty good, I would say.
Yeah, for the most part. And basically, you're just pooling your money in together with a bunch of other people. Your premium goes into the pool of money, and that money gets doled out as people need it.
Yeah. So we did that for a while. We just didn't feel like it was right for us after doing that for a year or two. And so we switched and we moved on to something else. We now have IMG insurance, which is actual insurance, and it's global insurance. You can buy this insurance so that it covers you both overseas and while you're in the U.S., or you can buy it so that it only covers you while you're outside of the U.S. And if you do that, a couple other countries are excluded too. But they have several plans available. They have the most affordable plans are the silver and the bronze. And for just putting in a couple people of our age, you can see here that it comes up to $369 a month for the silver plan and $266 for the bronze plan. So that is one that we have been using for quite some time now, and we've been pretty happy with it.
Yeah, and we have a little bit higher deductible. We have ours set at $5,000, and that actually came into play when I ended up having to have surgery when we were in Kuala Lumpur, Malaysia last year. In November, I had just we had our healthcare checkups there because Kuala Lumpur is great for, they've got incredible health services. And the wonderful thing about the services available there is that everybody speaks English. So it makes it super easy to go and get healthcare there. So we had scheduled full workups and different things like that. And I had an appointment with a doctor to check out some, things that were uncomfortable. And she said, you need to have surgery like now, as soon as possible. So I, within a few days then, was scheduled for surgery. I did have to have a CAT scan, extensive blood work, I think 2-3 times, I can't remember. My doctor's visits, her visiting me in the hospital twice a day. I was there for how many days? Four days? 4 days. And it's been almost 6 months now since that surgery. And the amazing thing is that we filed with the insurance company, and we still didn't meet the deductible.
Yeah.
All of that was, our deductible is $5,000, and all of the things that I just mentioned to you, plus more, out the door. You don't owe another dime to the hospital or the doctor or anybody. All of that out the door for less than $5,000. My mind was completely blown.
Yeah, I think it was $4,300 for everything, and that was with some pretty major complications. Things took longer and were more difficult than they initially thought they would be because the problem was worse than they thought. So that was kind of crazy. I also had some stuff done there. I had the health checkups done, and that went pretty amazingly. If you're ever looking for a place to do that, Kuala Lumpur is the place. We went to Glen Eagles Hospital there. Can't speak highly enough about them, the care that they gave both of us. And what's really amazing about it was the speed with which things happened. So we landed in Kuala Lumpur, and a day later, we were in the doctor's office getting the initial consultation, and then 6 or 7 days after that was the surgery. So 10 days roughly after we landed, she was home from surgery, and I had all my stuff done the day she was being admitted, because she got admitted so quickly. The whole plan was for me to get my checkups done before she had surgery, but they got her in for surgery so quickly that it ended up being the same day.
Yeah.
So, but all of my checkups were in one day. It was like eye testing, blood pressure, all the heart testing, basically anything you could think of, they were testing for it, blood work, and they get you those results back same day, which it's not like you come back 2-3 days later or wait a week. People that are not even just getting checkups in the U.S., you have something wrong with you, they still make you wait 2 or 3 days to get your blood work back. And this is just like a routine checkup. They get you your blood work back in 2 to 3 hours.
Yeah, it was kind of wild. Not just that, but you also get to see the doctor twice. You speak to the doctor before all of the results of all of the exams is done. They kind of discuss with you what are some, points that you're looking towards, or some areas of concern or anything like that. Kind of get a baseline from you if you're on any medications, all that kind of stuff. Then you go and do all your tests, literally head to toe are these tests. And then they still give you an appointment. Once all the results are in, they send that to the doctor, and the doctor gives you an appointment for later on in that day, and you come back, you have your appointment with the doctor, they go over all of the results with you, which is like mind-boggling to me.
Mm-hmm. Yeah, so I think a lot of the comments that we read on the channel are just people who don't really understand the situation with healthcare overseas, and it is complicated if you've never been through it. But we get a lot of comments in the vein of, well, if something happens while you're over there, you're gonna be financially ruined, and that's gonna wipe you out. And that's really just not true, because you do have insurance. Like, you have insurance just like you have while you're in the U.S. And in almost every case, whatever you're paying outside of your insurance is going to be less than what you would pay in the U.S. for the same type of thing. So even if something's not covered, it's just not going to cost nearly as much money as it would if something was happening at home and it wasn't covered, or just your out-of-pocket expenses like getting your medicines and so forth. Because we've had dental work done too, where we go in, have the dental work done, and then they write you a prescription for the antibiotics, and you go to the pharmacy and get the antibiotics, and there's no insurance involved in this. It's just, you just hand them the paper of what they're giving you. They don't run your insurance for this, because when they ask you to pay, it's like $1.50 for the antibiotics. It's not like $100, $200 for this medicine. There would be no reason to even use insurance. And that's what I think people don't really understand, is that a lot of the world doesn't operate under the same insurance models that we do, where all medicine is a $25, $50 copay. In a lot of the world, the same exact medicine that you're paying a $25 copay for is just $1.50, flat out, no insurance.
Exactly. I think that's what's kind of astounding too, is, medication is treated very differently overseas as well. Like, some people are concerned, or like, oh, well, what about like if you take medication, like what do I do? People have asked, like, I take medication for, blood pressure or whatever. They're like, well, do I have to bring like a bunch with me? You don't have to do that, because literally every single country we've ever been in, you could purchase things at the pharmacy. Just tell them what you need. A lot of times it's almost like a mini consultation, which is really insane. They ask you for symptoms and all those different things, and then they, tell you, okay, this is what you should get. Not even stuff they have behind the counter. They take you out to the floor and say, oh, this is what you need for, for the symptoms that you're having. If you have a cold, whatever, they will tell you what the best thing is. And again, you're looking at literally out of pocket just a few dollars.
So we did end up paying that $4,300 for her surgery, which was a really good price. Amazing care and all that. The reason we ended up paying that was because we had the $5,000 deductible, which we just felt like that was the right way to go, because that kept our premiums down to about $240 for us. That's when we signed up for it. That's what it was a month. Now there is another one that we've been considering called Safety Wing, and we do have a link to that also in the description, where they give you the same basic. It's the same basic price, but the deductible is much less. So the deductible would be $250 instead of $5,000. So that would have been interesting, because we would have actually met the deductible with your surgery to see what would have happened. And the difference between the two is that the Safety Wing, the total fee that they'll pay, there's a maximum for your policy. It's much less than the other insurance. So it's like $250,000. But you would have had to do what you did a lot of times to get up to $250,000. So
right.
$250,000 is going to take a lot longer to hit in some of these countries than it would in the United States. So it doesn't sound quite as low as it is. So that's one we're actually considering for the future. But you can take a look at that one also.
Yeah, I think the main reason, obviously, why we're looking at something like that is because the out-of-pocket health care, that you would pay for out of the country, out of the U.S., is so much less that, like in the U.S., $5,000, it's like, okay, yeah, well, you're going to cover that just in an ambulance ride to the emergency room, But out of the U.S., $5,000 goes a long, long ways.
Yeah.
I should have stayed in the hospital a lot longer.
You wanted more food, right? Yeah. So.
I wanted more Malaysian food in the hospital.
So I think the main takeaway of this is just to know how low cost healthcare can be in other places, and just understanding, for a lot of people don't have experience outside the U.S., that the U.S. system is vastly different than what it is in other countries, and you can't go into it thinking along the same lines, because it's just a completely different situation. You're going to be paying, you're going to be getting care quicker, and you're going to be getting care at a much lower cost than you would at home.
Yeah, and it really was so surprising. I had absolutely zero idea of what to expect when I got to the hospital. I was like, is it going to be like in the US? Is it going to, I don't know. I mean, I had seen pictures online, but I had never set foot in a hospital overseas. And we walked in, literally exactly the same, like all the signs and everything were in English in the check-in area. We checked in, and then they took us to the International Patient Lounge, which was blew my mind. Everybody there spoke English, just like everyone else really in the hospital. And, I sat there and waited to be processed and checked into, because my room wasn't ready yet. This was all including the fact that I got a private room as well. So you could do this for even less if you shared a room with 3 other people or with 1 other person. Mm-hmm. So you could do it for even less, or you could pay more and have gotten a suite or something. But it was really, I'll show you what it looked like here. But as you can see, the hospital room was just like a hospital room in the U.S. If there was no signage, you wouldn't know the difference between the U.S. and Malaysia. That's how amazing it is. And the service, the staff at the hospital was unbelievable. I was in the women's wing, and the only man that set foot in there besides Rob visiting me was the anesthesiologist. He came in there for literally he was in there for just a few minutes to explain what he was going to give me to put me under and have me sign the paperwork, ask me if I had any questions, and then he was gone. But other than that, it was all females. The cleaning staff, the food service staff, everyone was female, because there were also, it was also the maternity ward as well. So there were women having babies and all that kind of fun stuff going on as well, but all women on the floor, which I thought was pretty cool too.
Yeah, and you do hear a lot. An interesting thing is, when you're in the States, you do hear about medical tourism a lot. And you kind of wonder, is that a real thing? Are people actually doing that? And we can tell you it is a real thing, because we've heard from Canadians who said, look, our healthcare is free, but I can't get this done for 6 months, however long. They'll sometimes just fly to Malaysia and get it done. Like I said, we've landed, we were out of surgery in 10 days without even having met a doctor. So if you need something done, and then the cost was only $4,300. If you need something done, you need it done. You can't wait 6 to 9 months to have that done if it's going to be detrimental to your life. So you do see people who are taking advantage of this. We've seen it in other countries. You see it happen in Thailand. We've also seen dental tourism. When I was having some dental work done in Thailand, I was in the waiting room and like 4 guys walked in and they were all British. And I got to talking to them and they were like, we just came to Thailand because we all needed to get a bunch of dental work done. And we're all here to do this for 3 days. Then we're going to spend 7 days at the beach. And the whole thing was much cheaper than for them to get that dental work done back in the UK. So it's true, and it stands to reason that if people are leaving their home country and flying to these countries to get stuff done, that if you're actually in that country, like we were, it would be even better because you don't even have to fly there, and you actually have insurance that covers you there. So it really isn't as big of a problem, I think, as people like to think that it might be. It's just there's amazing care everywhere. The speed is amazing, and the quality of care is great, and it's just something that you really can't understand unless you've seen it and been through it.
Yeah, absolutely. Guys, hopefully this has answered some of your questions. If you have more, leave that for us down in the comments for us to answer, or maybe for ideas for future videos. Don't forget to subscribe, and we will see you guys next time.